Good morning, everybody. Good morning. I'm grateful to be here today to announce the Cook County reopening plan for the offices under the President. First, I'd like to acknowledge the individuals who've joined us today. I'm grateful to Michael Albert and David Jones for their sign language interpretation, Elizabeth Granato, who's our Interim Bureau Chief for Asset Management, and Bilqis Jacobs L., who's Director of Facilities Management. I'm grateful for Elizabeth and Bilqis' leadership and for the hard work of their staffs. They've helped employees to transition to a virtual workplace and now back to county facilities. In March, when we began transitioning our employees from on-site to remote work, our priority was continuing to safely provide all essential services to residents. This remains our highest priority as we begin reopening facilities to employees and the public. Offices under the President employees will return to work in phases over the next few weeks, and the county facilities will reopen to the public on July 6th. You will notice some changes to our facilities. While Elizabeth and Bilqis will go into further detail, you can expect changes such as being required to wear a mask or facial covering upon entering the building, or undergoing thermal wellness screenings as you enter the building, and finding comprehensive signage to maintain physical distancing as you navigate our facilities. In formulating and implementing the reopening plan, our goals are to prioritize the health, safety, and wellness of the public and Cook County employees, set expectations through consistent communication, consider fiscal restraints, and prioritize racial equity. We've been through a difficult time. While we've made incredible progress in slowing the spread of COVID-19 over the last few months, the pandemic is clearly not over. It's important that we continue to follow health guidelines, like wearing masks, practicing physical distancing, as we navigate this new phase. I look forward to seeing you back in county facilities soon. Now, Elizabeth, do you have a few words? Oh, Jose, just a second. We've been joined by Jose Rivera, our Deputy Chief of Staff. I didn't acknowledge you. I'm sorry, Jose, I didn't see you when I came in. Thank you.
Thank you, Madam President. Good morning.
Good morning.
Thank you, President Preckwinkle, for the introduction, and thank you to my colleague, Bilqis Jacobs L., Director of Facilities Management, for joining me. My name is Elizabeth Granato. I'm the Interim Bureau Chief for the Bureau of Asset Management. It's been several months since we've seen a wide array of county employees and guests walk through these halls. Since April, under the leadership of President Preckwinkle, the Bureau of Asset Management and other offices under the President established a reopening planning team. Since then, we have been working hard to implement safety measures and make physical modifications as needed in preparation to safely welcome our employees back to the county facilities in the coming weeks. While senior staff for offices under the President return to work in Cook County facilities this week, the first official wave of employees will return to work in Cook County facilities Monday, July 6th. The second and third waves of employees will transition to on-site work roughly 2 to 4 weeks after, as environmental and public health conditions allow. To safely reopen county facilities to employees and the public, we have relied on best practices, public health guidelines, and data to guide our decision-making processes. We are committed to a careful, methodical approach to safely reopen. Each of our departments and agencies are leading the effort to modify their workspaces for employees and for the public where applicable. Here are some of the operational changes Cook County employees and visitors will experience when they return to Cook County facilities. First, all individuals entering Cook County facilities will be subject to a health screening survey and thermal scanning. Bilqis will discuss this in greater detail in just a moment. All individuals entering a county building will also be required to wear face masks and practice physical distancing. Additionally, employees have been provided handbooks and must complete online Cook County reopening training before returning to the workplace. Each department and agency is also leading the effort to modify their workspaces for employees and for the public where applicable. To assist with this process, the Bureau of Asset Management and the Bureau of Human Resources developed a manager guidebook, which includes guidelines on accommodating at least 6 feet of physical distancing between desk and open workspaces, planning circulation patterns throughout workspaces, using utilizing directional signage or markings, managing interior conference rooms to prevent large gatherings, posting signage with maximum capacity in all public and employee gathering spaces, removing chairs to discourage excess capacity in lunchrooms, courtrooms, and lobbies, and posting signage throughout workspaces occupied by cubicles. Departments and agencies have also been required to appoint Cook County reentry captains to help coordinate their planning efforts. Prior to employees returning to on-site work, the Bureau of Asset Management will provide reentry captains with physical distancing kits that include supplies for reopening their county office. The Bureau of Asset Management will hold regular meetings with county reentry captains prior to reopening and after July 6th to ensure all county departments are receiving the support they need to safely return to the office. Now I'd like to turn it over to Bilqis Jacobs-L, our Director of Facilities Management, to discuss the additional facility modifications and changes.
Thank you, Liz. Good morning.
Good morning.
My name is Bilqis Jacobs-L, Director of Facilities Management for Cook County. Thank you, President Preckwinkle and Elizabeth Granato. In addition to what President Preckwinkle and Elizabeth have introduced, I will quickly talk a little bit more about the process and procedures that have been implemented to keep our county employees and residents safe. It might be helpful for me to walk you through what to expect when visiting a county facility after we reopen on July 6th. You may have noticed the large white tents outside, the entrance doors at 118 North Clark. These are being installed to keep all guests and employees covered, as everyone will be asked to wait in line to enter the building. There will be markers on the ground to encourage physical distance. To enter the building, a guest or employee will first receive a health screening. Upon passing the screening, the individual will be led to a thermal scanning station. The thermal scanning device is a contact-free way to take one's temperature. If necessary, a second temperature screening using a non-contact infrared thermometer will take place. No one will be allowed to enter a county facility without going through this process and passing the screening and temperature check. If an individual's temperature rises above 100.4 degrees Fahrenheit, entry will be denied. The denied individual will be given a denial receipt with the date and time stamped, facility name, phone number to call, and code indicating the reason for denial. Should anyone need to use an elevator, we have imposed a limit of 3 for this building, the county building. 3 people per elevator to maintain physical distancing and avoid crowding and contact. Also, from public counters to public information desks, plastic barriers or sneeze guards have been installed at all public-facing counters. The Department of Facilities Management has also increased custodial staffing across all county facilities to increase COVID-19 sanitation. Custodial staff will ensure frequent, detailed cleaning in bathrooms and frequent disinfecting in common areas, office spaces, and frequently touched areas, including elevator buttons, light switches, handrails, doorknobs, and information countertops. To expand on the efforts to clean surfaces, our facilities management team will perform regular bathroom checks and document the time checked. Facilities management has also increased air ventilation in Cook County facilities. County HVAC systems use high-efficiency air filters, which we will replace even more frequently to accommodate our reopening plan, which will also coincide with OSHA and CDC guidelines. To reiterate the President's remarks, we know this has been a challenging time, but as we all continue to transition to this new normal, we want to assure our guests and employees Cook County is taking the necessary precautions to make the reopening transition as seamless and safe as possible. Thank you. Turn it over to Madam President.
Okay, thank you. All right, we usually start with Rachel. How about Alice this time? Is that right, Alice? Alex?
Sure. Yeah. Hi, good morning, everyone.
Oh, okay.
I wanted to ask if you can give us some kind of breakdown as to how many employees are part of each wave. So, for example, the first wave Is that like 5% or 50% of employees? And then secondly, if you can talk us through some of the criteria for how it's decided who gets to be part of each wave.
All right. Jose, is that a question?
Liz might be able to answer that.
Okay, we're going to ask Elizabeth Granato to answer the question. It's about how many employees are coming back in each wave, and what are the criteria for deciding which employees are in the wave?
So the first wave capacity is limited to 50% or less of their full-time employee count. The individuals who are, the criteria that's being used to select the individuals that are to return in each wave is based upon what that that department's operational needs are. So first prioritizing those who have to be in the office in order to perform their job functions. All managers and supervisors have been advised to take into account the individual health needs of employees before choosing when to return them, so that those employees who feel that they may be in higher risk categories will continue to work from home until it is safer to return to the facilities. As we continue into future waves, we will continue to follow the public health guidance that's issued by IDPH, as well as the guidance issued to businesses and industries under DCEO to identify what is the appropriate capacity limits for our facilities.
Thank you. I'd also like to ask about meetings, whether, Madam President, there is any kind of foreseeable timeline in place for returning to in-person meetings, either for the board, for advisory committees, for commissions, or whether we're basically looking at these kinds of virtual meetings for the foreseeable future.
I guess I'd say, Alex, the question is how long will we continue to have virtual meetings? I think that's to be determined. We just had a virtual meeting of our Economic Development Advisory Council, EDAC, this morning. And of course, we've got a virtual board meeting on Thursday. So I guess the answer to the question is to be determined.
Okay, thanks. And I had a few questions off topic, but if you can come back to me for those later.
Thank you. Rachel?
Hi, yes, good morning.
Good morning.
Going back to, I guess, Alex's first question, I guess the 50% of people who have to work in the building, is that 50% of those entirely who work on the county side, or is it 50% per, like, department? I guess, can you break it down maybe a little bit more?
All right, so the question, Elizabeth, is that 50% per department, 50% of the people who work in the building? What are we talking about here exactly?
Sure. So we have identified what is 50% of the full-time employee count for each department. And that is the maximum capacity that those departments can return back to the facilities. We anticipate that many of them will return even less than that, given the considerations for employees' health concerns. But it is based on the current full-time employee count for those departments, which varies by department.
Got it. And I guess, can you talk about how this plan might change? Should we see a spike now or in the future, like in the fall or the winter time?
So the question is how the plan might change. I guess I'd say the answer to that is to be determined as well. Jose, did you want to respond to that?
Well, you're correct, Madam President. It depends on conditions as they evolve.
Okay, Jose Rivera, our Deputy Chief of Staff, has been in charge of our reopening plans. And his response is that it's contingent upon, conditions. That is there a spike in the number of people who test positive? Is there a spike in hospital bed utilization? Is there a spike in ICU unit utilization? All of the metrics that we've used to sort of ratchet down the shelter-in-place order up to this point.
Thanks. And then will people, I guess, by department be able to decide for themselves whether or not they want to come back to the office, whether or not they feel safe enough? Or is it kind of a department mandate that certain employees have to come back by July 6th?
Okay, so the question, Elizabeth, is what's the criteria for deciding whether an individual employee comes back or not? Jose, did you want to speak to that?
So when we did our analysis with departments and we determined the employees' needs, it broke down to the capacity level for each department, and we're gradually doing this, and so we have our foot on the brake a little bit, but we're just as conditions allow, we are going to gradually have waves come back.
And then for the second and third wave, and I'm sorry, it cut out for a little bit, so I might have missed this. The second and third wave, what percentages of employees by department will be allowed back in for the second wave and then the third wave? Or is that also to be determined?
So, Jose, the question was second and third wave. What percentage will be allowed back in, or is that to be determined?
That's to be determined.
All right. Some unanswered questions to be determined.
I also have off-topic questions. I will yield to Alex if you'd like to go first.
All right, Alex, off-topic questions?
Okay, yeah, I thought I would just throw in a question about the preliminary budget forecast for 2021, whether that looks like it's still on pace to be released by the end of this month, and whether you can give us any indication of what we should expect from that at this point.
So the question is, will the preliminary budget be released according to our usual time frame? The answer is yes. And can I give you projections? No.
Fair
We're
enough.
still working on it.
I also, okay, was hoping I could throw in two questions about the Cook County Land Bank Authority. First, notice that on the board meeting agenda tomorrow is the nomination of Maurice Cox, Chicago's planning commissioner, as a board member of the Land Bank Authority. I was wondering if you could take a second just to talk to us about that nomination, why you feel he's an appropriate candidate for that. And then secondly, if you could just give us an update on the audit of the Land Bank Authority that you had announced at the end of last year.
So the first question is about Maurice Cox and his nomination to be on the Land Bank Board. There's a position on the Land Bank at the discretion of the mayor to serve. And the mayor has nominated Maurice Cox, and we will, of course, accept her nomination. So that's the first question. The second question is the audit. I think the audit's going to be released later this week. That's my understanding. Soon.
The results of the audit?
The results of the audit will be released soon. Before the end of the
Okay,
week.
thank you.
All right. Rachel, do you have any off-topic questions?
I do. Following Attorney General Raoul's, positive diagnosis for COVID, I guess, will you be self-isolating? Will you be quarantining? Will you be doing anything like that?
Well, fortunately or unfortunately, I had to leave that event early because we were in Calumet City and I had an event in Maywood. So I left early and he came late. So basically we were never in contact. So I'm not going to be isolating or quarantining.
I guess so. Are you worried at all that you may have come into contact with someone he had contact with, even though you didn't personally cross paths with him?
If you step out of your house, you potentially come in contact with somebody who has the disease or has been in contact with somebody who has the disease. Public officials are no exception.
Yes, and I guess yesterday you said you're not going to be retested because you didn't come into contact with him, but again, you could have come into contact with anybody who has this thing and who may not know it themselves at the moment. I guess why not get retested just to be completely sure?
I've never been tested. I have no symptoms.
Why not get tested? I'm sorry, to be sure.
My view is we should save the test for people who, first of all, are first responders or are in our healthcare fields, or people who have symptoms. And I'm not in any of those categories.
Okay, thank you.